Drinking good amount of water, keep your kidneys healthy.
There are people I know who drink 8 to 10 liters of water a day. Sure, those people must be in the restroom most of the time. Drinking too much water, sodium levels are low, it's a life-threatening situation.
Family died kidney failure.
If you do have a family member who has a kidney disease, it's a red flag.
Normal amount of salt one can take.
So if you take too much salt with high blood pressure, if you don't treat that, you will end up with kidney disease. Rice, salt and sugar. 3 white things are very dangerous for you.
People can identify their kidney diseases.
Don't ignore subtle signs. Try and find an answer for everything. One dose of a painkiller can knock your kidneys out.
People having diabetes and hypertension, silently damaging their kidneys.
Unfortunately, these diseases, they have no symptoms. If you don't take care of your kidneys, we might have to take care of it for you. Apart from Dr. Ravi Andrews, I also call myself Dr. Homo sapien.
Today's podcast, we have with us a senior consultant nephrologist, Dr. Ravi Andrews from Apollo Hospitals, Jubilee Hills. Every year, more than 2 lakhs of kidney failure cases are being registered in India. Why kidney diseases are moving towards kidney failures? Are there no treatments for kidney problems? Dialysis necessary for every kidney failure patient or even chronic kidney disease patient? How successful are kidney transplantations? Welcome to our podcast, doctor.
Thank you very much, Dr. Vani. It's a pleasure and an honor to be here.
Can somebody have a kidney disease and they don't know it? Can it be true?
Definitely, when you have a well-proven kidney disease, the creatinine or urea will be elevated, but not 100% of cases. There are, like you said, there are certain cases where you will have kidney disease, but your creatinine and urea will be normal. So creatinine and urea are basically tests which we do in the blood to understand the kidney function. But there are certain kidney diseases, like say somebody is losing protein in the urine. It's called nephrotic syndrome. In nephrotic syndrome, classically, the creatinine and urea will be normal, but there will be protein leakage. And this, over a period of time, can cause further kidney damage and then cause the urea and creatinine to increase. Another example, there are people who are born with just one kidney.
Okay.
These people will have a normal creatinine, but because they have one kidney, we label them as kidney disease. I'll give you a very classical example. I'm sure the viewers would have heard of Anju Bobby George. Anju Bobby George is a long jumper. She won a gold in the World Athletics Championships. I'm not talking about Indian championships. In the World Athletics Championships, she won a gold and subsequently she won a silver as well. So she's won 2 medals in World Athletic Championships and she has only one kidney.
Oh.
And this was found after she won the gold. And after she found this out, she went on to win a silver the next time. So what I'm trying to say is, even though you have no symptoms, you could still have a kidney disease, and having a kidney disease does not prevent you from living a normal life. These are the 2 points I want to bring out here. Earliest sign of kidney disease most of the time is very subtle. You might have a little bit of swelling, tiredness, your face might look puffy when you wake up, your urine might be frothy, your blood pressure might be slightly high. So these are very subtle signs and most of the time we miss them. And the definitive method to find out is to do a urine test, an ultrasound and a creatinine. Unfortunately, normal individuals don't get it done. People get their blood sugars done, they get their hemoglobin done, they get their BPs checked. Cholesterol, these are the standard things people do, but nobody really specifically tests a creatinine, urine and ultrasound.
After 40 years, like in cancer, we had an oncologist on a podcast. So he was like, you can start screening for certain cancers after 40 years. So for kidney diseases, do they have to get all these tests at after 40 or after 50?
My suggestion would be before 40 itself, maybe around 20, 21. Most of the people by that time they're ready for employment. So in a pre-employment checkup, my recommendation would be to include a blood pressure evaluation, a creatinine, a complete urine examination and an ultrasound. This should be there in every pre-employment checkup. So by the age of 20 to 25, people are already got a baseline test. If there's something abnormal there, they need to do tests more frequently, maybe 6 months, once a year, once in 2 years. If everything is normal, then I would say after your pre-employment check, once in 5 years, till the age of 40, you will do this test. After the age of 40, you would do it once in 2 years, provided everything is normal, of course.
Oh, okay.
After the age of 50, you do it every year.
Every year, okay.
Yes. And these are basic tests.
Basic,
they're not very complicated ones. So I think it's easy to, at the age of 50, it's easy to do one once a year.
Someone in the family died with some kidney failure and all. So do the children in that family have to be alert and get themselves regular checkups?
It's a good question. There's definitely, in certain kidney diseases, there is a genetic underlay. You might have some genetic preponderance to the condition, but these are very rare. There, I think, less than 1% of kidney disease would have a genetic overlay. But if you do have a family member who has a kidney disease, it's a red flag. It means that you must definitely do a baseline investigation, and then if that's normal, then at least once in 4 or 5 years get it checked. If it is abnormal, then you need to see a nephrologist and make sure things are all right. Of course, genetics is something we cannot modify, but the lifestyle changes which could impact the genetic condition could be modified, and that could help you in the long run.
Yeah, and we can also prevent the complications.
Exactly.
People know that if you drink good amount of water, you can prevent kidney disease, especially kidney stones and all those things. So is it true that drinking good amount of water, you can keep your kidneys healthy?
The $1 million question is, what is the definition of good amount of water? Now, is it 2 liters? Is it 5 liters? Is it 10 liters? There are people I know who drink 8 to 10 liters of water a day. I don't know, I'm sure those people must be in the restroom most of the time. There is always a limit to everything. The recommendation from a nephrology perspective is 2 to 3 liters a day. That includes all liquids. It doesn't have to be water. So tea, coffee, milk, buttermilk, those kind of things. No beverages, no alcohol. That's not shouldn't be counted in these things. So 2.5 to 3 liters are optimal. If you sweat a lot, or you work a lot outside in the sun, or you do a lot of physical activity, like you're an avid gymmer or something, or you play a lot of games, in that situation, maybe you can increase by 500 to 1 liter.
Extra.
So 3 to 4.
Yeah.
More than that is counterproductive. What happens is, if you drink too much water, one is the kidneys are working overload because that's the only way it can excrete it. So you're stretching out your kidneys by making them work harder to remove the water loads that you're putting inside. The second problem with drinking too much water is it dilutes the chemicals in the body. Essential chemicals like, say, sodium, magnesium, these things get diluted. So when the sodium is diluted and the sodium levels are low, it's a life-threatening situation. I'm sure the viewers would have heard of Bruce Lee.
Yeah.
Bruce Lee died, and now research has shown over these decades of his death that he died because of excess water drinking. So his recommendation was to drink lots and lots and lots of water. And he used to tell, his famous statement is, "You are like water." So he used to drink a lot of water, and when sodium levels drop, your brain swells.
Yeah.
Cerebral edema. And his brain got swollen and he died because of low sodium. So excessive water drinking can kill you. Stone disease, yes. Even stone disease, the recommendation is around 3 liters. If normal people is 2 to 3, for stone disease, to prevent it, is 3 liters. Below 2 is again dangerous because you get dehydrated. So if you get dehydrated, your kidney can give you trouble. You can get stones, like you said, and other chemical imbalances could happen when you're dehydrated.
Yeah.
You see, social media is a double-edged sword. It can be good, it could be very dangerous as well.
Correct.
But as far as medical science is concerned, social media is not the right place to go to. You have plenty of doctors, plenty of competent doctors who will give you the correct advice. Social media the advice is given by non-medical people. If you want a case to be fought in the court, you will not go to a person who's not a lawyer, you'll go to a lawyer. If you have a problem with your finances, you will go to a chartered accountant, somebody who has been trained there. If you have some IT problem, you'll go to an IT person. You will not go to social media and search. So why do people need to go to social media for medical advice? And why do people on social media give medical advice without being competent is something which I've never understood.
Yeah, that's our main motto of starting the Doctor Podcast channel, because like a lot of influencers are giving medical advice. So we want doctors to become influencers.
Exactly.
To give the real medical advice.
And we want to be influencers only for medical advice,
Only
not
for
anything
medical.
else.
Yes.
We're not interested in anything else.
Yes. Whey protein and all these things. And also there's also a misnomer that if you eat a lot of protein also, you might damage your kidneys. So how true is that?
Every statement in this world has always got two aspects of it. There are always two ways to look at it. So listening to a blanket statement like too much protein powders are not good for you, too much protein is not good for kidneys, there are always something else around it. There's always this gray zone. But all put together, eating natural protein, good amounts of it, is not going to harm your kidneys, provided you have normal kidneys. If you already have a kidney dysfunction, if you don't have a kidney problem, you can eat large amounts of natural protein, and that includes animal as well as plant protein. If you have a kidney disease, you've got to be careful about your protein intake, but speak to your nephrologist, he will guide you. Coming to protein powders, now that is rampant all over the place. Everywhere you go to the gym, and the young boys will be having that flask, they'll put something inside and they'll be shaking it, and then they will be drinking it, and this the pre-workout, post-workout, all those things. Again, the problem with the protein powders is, one, anything that comes off a shelf which is not freshly prepared is dangerous. Why? Because it is preserved. And the commonest preservative is salt.
Oh,
It's ubiquitous. Anywhere, anything that comes off a shelf will have salt as a preservative. And if you take too much of it, salt is dangerous. Salt will increase your blood pressure. Salt will cause water retention. Salt can cause your kidneys to get worse. Problem is, if you already have a kidney dysfunction and you're taking these protein powders without understanding, your kidney function is going to get worse. Your creatinine is going to increase. And a lot of these powders have creatine in it. Creatine is a precursor of creatinine. So creatine is produced in the muscle, and then it converts to creatinine, which is supposed to be excreted by the kidney. So if you take too much creatine, which is there in the protein powders, your serum creatine is going to increase, and your kidney has to work overtime and is overloaded to excrete it. So my advice to the viewers and to all the gymmers out there is, do not go for protein supplements. If you want to increase your protein intake, then you can take natural proteins, both veg and animal protein. If your job depends on you being all muscular, like for example, if gymmer in the sense you're going for competitions, bodybuilders, for those people, yes, protein supplement, because you cannot get enough protein from natural sources. So protein supplements are okay, but you might have to pay the price for it later. And anyway, I think in today's age, thin is in. Nobody wants to be that muscular like old days. Everybody wants to be lean and mean and clean. So for that, you can avoid protein powders and take natural protein.
So as a nephrologist, you say no to protein powders.
Absolutely. In fact, a lot of young boys come to me in the gym and ask me, sir, should we take protein powders to build up our muscle and all? And I always say no.
Natural protein
Go
is always
natural.
better.
That's the best.
Yeah, it's easily available, economical.
Yes, and not just in protein, anything natural is always the best way. Natural might be slow, but it's safer.
Salt. Normally we say less sugar, less fat. But again, a lot of people unknowingly or knowingly we eat a lot of salt hidden in a lot of foods.
True.
And that also might be one reason that a lot of people are having kidney issues.
Yes.
Like in India, we are developing, though we don't eat that much protein, we develop a lot of kidney problems over the years. So maybe because of salt hidden in pickles, papad and all these things. So as a nephrologist, what is the normal amount of salt one can take?
I'll add one more hidden salt to you. Pastries.
Oh, okay.
Yes, bakery items. They feel sweet, right?
Sweet
but
and
bakery
butter.
items have salt in it.
Oh, okay.
Pastries have salt in it. So even bakery items, though you think they're sweet, but they will have salt in it also. Plus all the other things, butter, cheese, those things.
Fat.
Yeah. One of the commonest causes of kidney disease is blood pressure and diabetes. Blood pressure happens with salt. Blood pressure is related to salt. The more salt you take, the more your blood pressure is going to be. And blood pressure will lead to kidney disease. Before I tell you about how much salt is required or how much is optimal, I'll tell you the three dangerous whites. This is what the audience also will remember. The three dangerous whites are rice, salt and sugar. So these three white things are very dangerous for you. Rice will increase your weight, increase your belly, increase your cholesterol, increase your sugars, high glycemic index. Sugars will cause all sorts, we all know what sugars can do. And salt can cause high blood pressure and water retention. And kidney disease finally. And heart disease, a lot of things. Salt creates lots of problems. So these are the three whites that you should avoid. Now as far as the required amount of salt, our general Indian diet, we eat about 8 to 12 grams of salt per day. The recommendation is 6 to 8 grams is just optimal. Below 6, the taste will not be there, you will not want to eat. More than 8 can cause water retention and high blood pressures. So 6 to 8 is what I recommend. Now if not easy, right, to measure 6 to 8.
Correct.
What I would say is, whatever salt you eat normally you're cooking, reduce it by 25 to 50%.
Okay.
The whole family.
Yeah.
It's good for everybody. And you will notice that once you've reduced the salt in your diet, After some time, even if you go back to your original salt diet, you will not be
You will
able to
not
eat
like
it.
it. Yes.
You will be very happy with the less salt, and salt is an acquired taste.
Correct.
You were not
Correct.
born
Not born
requiring
with
salt.
Yeah, yeah.
Salt came into the human abdomen, if you want to gut, if you want to put it that way, because of trade. Because in the olden days, when people wanted to transport food material from one place to another, they had to preserve it, and they would use salt as a preservative. So, country A would export their food to country B. They would put salt, and it would go to country B. Once country B gets it, they have no way to remove that salt, so they would cook it with the salt, and they got used
Okay, okay,
to the
got
salt. And
it.
this is how human beings evolved and developed this taste for salt. We don't require salt in our natural diet. In a normal diet itself, natural diet, you get enough salt.
So it's like 6 to 8 grams is the optimal amount which
6
we
to 8
need.
is, so if you ask quantification, 1 teaspoon would have about 5 grams of salt. One full teaspoon, one heap
Okay.
teaspoon would have
Teaspoon.
around 5
5
grams.
grams.
So give maybe one
1
and a
to
half
one and a
teaspoons
half. Yeah, yeah.
in your whole day cooking.
Yeah.
And don't take added salt like chips and pickles and mixtures and pizzas and french fries. I mean, once in a while, yes,
Yeah.
but not
Not
on a regular
daily.
basis.
Yeah,
Yeah.
not daily.
The day you have something extra like a pizza or something, compensate somewhere else. Eat something else with less salt or whatever. What you can do is that salt and pepper cellar which is there on your dining table, remove it.
Correct.
That's it. So there's
Yeah.
no question of added salt again is a dangerous thing.
Yes.
Because when you add salt, you tend to add more than you require.
Yeah, yeah.
And you can't control the amount you're adding. So
Correct.
added salt is a no-no.
Even while making rotis also, a lot of people tend to add salt in the atta.
Yeah.
So that, I mean, I saw it from my mother-in-law. So then I told her, don't add salt in that, because anyhow we are eating with some vegetable which
Exactly.
has
That has
salt
salt. Yeah,
already.
yeah, exactly.
So in that way, the whole
Urine.
family will not eat more salt. So that simple changes people can take.
And it's good for the whole family.
Yeah,
to
yeah, that's what.
And if the whole family can do it together.
Correct.
If
Yeah.
you try to keep only one person in the family with less salt, he's going to grumble a lot, and then there'll be trouble. There'll be a lot of infighting. Civil war will go on within
Yes.
the family. So the whole family, and it's good for the whole family.
Yeah, can you tell us some top 5 signs where people can identify their kidney diseases?
Okay, so this is like a rapid fire now. Okay, let me figure it out. 1, swelling in the feet. So if you find that your feet are swollen by the evening, or when you get up in the morning, your face is swollen, that is one sign of a kidney disease. It needs evaluation. Of course, there are a lot of other reasons for swelling in the feet, but the commonest one is kidney. So if let's go back to the causes of swelling. It could be anemia, could be thyroid, could be heart disease, liver disease, kidney disease, drinking a lot of water, and taking a lot of salt. But generally, kidney disease is one thing. Second, the quantity of urine. Now, there's a misconception that if you are passing less urine, there is kidney disease. But even if you are passing more urine, there's a likelihood that there could be kidney disease.
Oh, okay.
So, passing too much urine or too less urine is another indicator of kidney disease. By too much, I'm saying more than 3 liters of urine per day in 24 hours. By too less, I mean less than 1000 ml or 1 liter of urine per day. Excess urine or less urine. If the urine looks very frothy and foamy, then there's likelihood that you're passing protein in the urine, which needs evaluation. There are a lot of other reasons for frothiness.
Correct.
But protein is one of them, and that's the dangerous one. So if you feel that you're passing, and when you get up in the morning, anyway, the urine is concentrated, it looks frothy. So don't panic there. But if you feel that it's excessive or suddenly started becoming more frothy or foamy, then get a urine test, and it will tell you whether it's protein or not. If there's no protein, then you don't need to worry about it. The advanced signs of kidney disease, warning signs is, but this is in advanced kidney disease, where you lose appetite, your hemoglobin drops, you feel lethargic, you feel weak, you might be vomiting. These are all signs of. Fifth one, you are very confused, dull, sleeping most of the time. These are really advanced signs of a kidney dysfunction. The problem with kidney disease, it's only after a certain stage, after more than 75% of the kidneys are damaged, that's when you get all these late signs, like the nausea, the vomiting, loss of appetite, the drowsiness, the confusion, palpitations, burning in the feet, or those kind of things are only when 75% are damaged. It's really too late by then.
Correct.
So the subtle signs you need to look for is one, the changes in the urine output, changes in the consistency of the urine. Is it frothy or not frothy?
Yeah.
Swelling in the feet or face when you wake up, and feet in the evening. blood pressure going high.
Blood
These
pressure.
are also an indication that you have some kidney disease.
I mean, swelling and all, like people will get alert,
They
right?
will notice
Yeah,
it
once
immediately. Somebody,
their feet is swollen and all.
they will
Yeah,
know because the shoes will get tighter,
yeah, yeah.
or the slippers will feel that, or when they press it, it sinks in but doesn't come out the
Correct.
skin. And the family member will tell them, "Arey, your face is all puffy. You woke up in the morning."
Because we hear the elders in the family telling like పొద్దున్న లేవగానే like కాళ్ళు వాపులు ఉన్నాయి. So all these signs they keep telling, and then
Yes.
we get them either a heart test or a kidney test or both
Yes.
to evaluate. So
Dr. Vani, mostly what happens is, patient will come and say, ప్రయాణం చేసినాక మాకు కాలు వాపులు ఉంటాయి. So that is, they think it's normal, but it's not.
oh, is it?
That needs evaluation. So
I thought it was normal.
no, swelling anytime. See, normally your feet should not swell.
Okay.
And how do we know? The veins in the leg, the feet, no, those should be visible. If they're not visible and you can press and the hole stays behind, that means there's swelling. So if you're swelling when you're traveling after a long period of time, then definitely at least ఒకసారి you need to evaluate. After that, if it's normal, then you can relax and say it's normal. But చాలా మంది అనుకుంటారా ఉంది స్వెల్లింగ్ ఉంది ట్రావెల్ చేస్తేనే ఉంది మర్చిపోండి. So but that's not. So ఒకసారి you need to get a test to make sure if it's not there, it's not there.
When I used to travel in bus, so I used to get swelling of my legs. So that time I was not diagnosed with hypothyroid. So I didn't know that I had thyroid. So we rarely think, doctors think we don't get diseases.
It won't happen to us. It'll happen to them.
We were like, who has problems? I
Yeah.
was like freshly out of medical college. So I traveled to Kolkata sometime, and there I met a gynecologist, and she was a very old gynecologist, experienced. She just looked at me and she told, I think you have hypothyroidism, go get yourself checked. So that's when. So I think hypothyroidism also
cause
causes
swelling.
water retention
Absolutely.
in the body when you're not under medications. So as you said, I was thinking like long hours travel చేస్తున్నాం కదా, so it's normal అనుకుని I neglected it for ages. One gets a kidney problem, so can it be reversed or it is irreversible?
So there are three types of kidney disease. One is called acute kidney injury, another is called chronic kidney disease, and there is a combination acute on chronic kidney disease.
Okay.
Acute kidney injury means that you have a kidney problem for only last 3 months. Now we are in August, so in 3 months ago would have been May. So in May, if you prove you have a blood report saying your creatinine is normal, and now in August it is say 3, normal being 1. So it is 1 in May, and in August it's become 3. This is an acute kidney disease, acute kidney injury. Chronic kidney disease is a kidney disease which has been going on for more than 3 months. And I'll give you examples later on of each of these. So say in May your creatinine was 2, which is not normal, and now in August your creatinine is 3. So this is called chronic kidney disease because it's a pre-existing kidney disease which is there for more than 3 months. There is a third entity called acute on chronic kidney disease where you already have a baseline kidney disease, and for some reason there is a sudden worsening. So say in May your creatinine is 2, then in August it becomes or July it becomes 3, in August it becomes 4. So it is very rapidly rising. So that is an acute on a chronic. So you already have a baseline creatinine of 2, and now it's become 4 or 5 because of some acute reason. Causes of acute kidney injury: dehydration, vomiting, certain painkillers, blockages, say some stones or something. These are the common causes. So over the pill counter, over the infections. So infections, blockages, dehydration, unnecessary painkillers, antibiotics, medication-induced kidney disease. These are causes of acute kidney disease or acute kidney injury. The common cause of chronic kidney disease: diabetes, blood pressure, recurrent infections, infections which are not treated properly, stones which are again recurrent, and some genetic diseases. These are chronic kidney disease. And the acute on chronic is when you say you have diabetes and then you develop a urine infection, then the creatinine can suddenly go up. Or you have diabetes and then you develop a stone, the creatinine suddenly goes up. You remove the stone, the creatinine comes down, but the diabetic kidney disease remains, but the stone part is taken care of. So you come back to your baseline chronic kidney disease. The difference and the importance to differentiate between these three is treatment. If you can identify somebody as an acute kidney disease, you will try and identify the cause and you will treat it. And if you treat it, lo and behold, the kidney will become normal.
Oh,
So that's the beauty of diagnosing acute kidney disease. The kidney might fail completely. You might have a creatinine of 10 also.
correct.
You might be on dialysis also. But if you can identify the cause and treat it, you can come back to a normal creatinine. So that's the importance of trying to make a diagnosis. And by definition, acute kidney injury is reversible completely. Chronic kidney disease, unfortunately, is irreversible, again by definition, and it's progressive. So you start with the creatinine of 2 in May, it is slowly going over the years, it's going to increase, and that's inevitable. All you can do is slow it down. So you cannot reverse it, you cannot stop it, but you can slow it down to a significant amount. And acute on chronic, again, if you can find out the acute reason and treat it, at least you will come back to your original baseline creatinine thing. It's a long answer to a short question.
No, that's
Ki,
okay.
what are the types of kidney disease and can they recover? And I also want to mention here Ayurvedic and homeopathic medications. I know Ayurvedic and homeopathy doctors are going to be very angry about this, but Ayurvedic medicines have been shown to have problems and can cause kidney injuries. Homeopathy is so far not very really proven, but neither proven here nor there. But definitely, I've seen patients who have taken Unani and who have taken Ayurvedic medicines who have come with sudden increases in creatinine and acute kidney injuries.
Even in our medical college first year, one of our classmates in Varangal, so he got jaundice and he took some Unani medicines,
Yes.
and unfortunately he died.
Oh.
So it was like either some liver failure because I think he was taking both together, allopathy and Ayurvedic. So we were not very educated at that time. So from then onwards, like if anyone in family also, as I tell them to take Ayurvedic external cut treatment, whatever you want to take, but internal. If you're already on an allopathic journey and suddenly somebody says you take each month తీసుకోండి ante it might not suit
It
well
is
for
dangerous,
you.
yes.
Yeah. Recently in LinkedIn also I saw one post, doctor. There was one young doctor who died or who had a chronic kidney failure because she was on medications, painkillers,
Oh, yes.
antibiotics,
Yes.
and all these things.
Yes.
And she was studying for all plastic surgeon. I don't remember the specialty, but she did her medicine, she did her PG and then super specialty, and then she was ready to live her life. Like she has a family, small family, and all that. She was ready to live her life, and then that's when she was diagnosed with chronic kidney failure, and I think she died also. So she wrote a very long post on her social media, and she mentioned that be careful when you're taking painkillers because
Exactly.
she was suffering with the lack of sleep while doing her duties and all. Fever, even if she had fever or any pain, she had to pop in pills and go for her duties. And also when you're taking medicines, painkillers continuously, like past 5 years, that can affect you after 5 years or
True.
6 years.
So painkillers can cause both acute kidney injury as well as chronic kidney disease. So sometimes even one dose of a painkiller can knock your kidneys out. And if that doesn't, if you go on taking it for months or years, it will cause chronic kidney disease, later kidney failure.
Yeah, that's
And
what.
the dangerous painkillers are things like Brufen, Combiflam, Voveran, Nice. Nice is banned now, but still I think it's still available. So these are the dangerous ones from a kidney perspective. The safest, in my opinion, is Dolo paracetamol. Paracetamol is the safest, and of course it's not as effective as the others, but Hyphenac, these are also dangerous.
Oh, okay.
So paracetamol is the safest from a kidney perspective.
Yeah. This muscle relaxants are safer. Meftal
Yes.
spasms girls take for.
Yes, they are
They are
safe.
better.
They're
safer
better, but
side.
see, every drug has a side effect, and Meftal actually has mefenamic acid, which again is an NSAID, which again is dangerous for the kidney.
Oh, is it?
So Drotaverine is probably safer.
Yeah.
So that's, I mean, see, every drug has a side effect.
Correct.
So you have to decide which side effect you are ready to face.
Anything you should not depend on it for longer periods
Exactly.
of time.
Minimize the
Let's
idea.
not depend on medicines.
The whole idea is to reduce medicines as much as possible.
Yeah.
Don't keep popping pills for everything.
Yeah.
And again, that's one message I want to send across to the viewers. Don't take medicines unnecessarily. Take it under the guidance or supervision of a medical person who understands the side effects. Because we take it for the effects without understanding the side effect.
Correct. These days, medicines, even Zepto and all, they're delivering medicines, is what I heard. So again, just because it is easily available,
Accessible. Oh yes, medicines.
easily
It's like you're
accessible.
like Swiggy. You can get food whenever,
So
you get medicines whenever. That's again dangerous.
yeah,
Over-the-counter medicines. I think the government should make a strict regulation not to just give off medicines like
without a
this.
prescription,
Yes.
valid
Yes.
prescription. Yes, so yeah, because like they don't know, they might be having some other gene which is not, which might not, the medicine might not suit for them also. They may be allergic for that medicine. So multiple.
Nowadays, you can do pharmacodynamic testing of a whole lot of medicines, right from carvedilol right down to any drug, to an antibiotic or painkiller. You can do pharmacological testing for all and identify. This is called precision medicine. You can identify which particular person is allergic to which particular medicine. You can do that also. That facility is also there. So you can precisely treat a patient with a disease using a medicine which will suit him and not cause a side effect
Oh
and be as
wow,
effective.
nice,
So we
nice.
have those facilities as well.
So people having diabetes and hypertension. So what mistakes do you think they are doing that are silently damaging their kidneys?